Picture this. A parent calls in for a late afternoon virtual visit. Clear photos, a calm clinician, and a child who gets better at home. Now imagine a pixelated dark video with an adult gasping for air. The call ends and nobody really knows what to do next. Tiny differences in prep and language turned one visit into safe care and the other into confusion. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is FAQ by Nurse Jessi, where healthcare facts beat internet myths. Let's separate medical fact from fiction and make your next virtual visit actually helpful. So today, I'll give you practical steps. When telehealth works, what to prepare, exact words to say, safe camera exams you can do, and how to get a clear escalation plan if you need in-person care. First up, when is telehealth actually a good idea? Think follow-ups, medication questions, mild respiratory or urinary symptoms when breathing is stable, minor rashes, mental health check-ins, and interpreting lab or imaging results you already have. Basically, problems that can be assessed by history, photos, or a simple visual check. Telehealth is great until it isn't. If you're fainting, gasping for air, bleeding heavily, having chest pressure, or experiencing sudden neurologic symptoms like slurred speech or sudden weakness, those need immediate in-person or emergency care. Don't troubleshoot those over a shaky video. Call emergency services. For everything else, telehealth can get you faster help, if you come prepared. So let's talk prep. Tech basics. Charge your device, test camera and microphone 10-15 minutes early, and pick a bright room. Put a lamp behind the camera, not behind you, so you aren't a silhouette. If video is patchy, a clear phone call is better than a garbled video. Jess, quick question. What if my Wi-Fi drops mid-visit? I panic every time. Good question. Right at the start, say, if my video fails, can we switch to a phone call and I'll text photos? That gives you a fallback and saves time. Clinics expect tech hiccups. Ask for a phone backup or secure photo upload option. Gather these things before the visit: a current medication list with doses, known allergies, recent vitals if you have them, temperature, blood pressure, heart rate, and pulse oximeter reading, and clear photos of any rashes, wounds, or swelling taken in daylight. Keep the medication bottles nearby so you can show labels on camera if needed. I once had a patient hold up a tiny bottle and we solved a dosing question in 30 seconds. That little bit of prep saved an extra visit. Try this quick pre-visit checklist out loud. Charge device, test audio and camera, have photos and meds ready, choose a quiet, well-lit spot. And if you're caring for someone, have them and any mobility aids nearby. Say it like a script, and you'll actually do it. Okay, what about describing symptoms? I always feel like I forget something important. Clinicians want a clear timeline and measurable details. Start with the most important fact, when it started. Then say how it changed, what makes it better or worse, and what you've tried. Concrete numbers help. Pain on a 0 to 10 scale, temperature in degrees, oxygen saturation as a %, breaths per minute. Curious. Instead of, I've been sick for a while, say, symptoms began 2 days ago after a cold. Fever peaked at 101.4 degrees Fahrenheit yesterday, now 100.2 degrees Fahrenheit. Cough is worse at night, and I'm taking acetaminophen 500 milligrams every 6 hours with partial relief. That tells us cause, timing, intensity, and response to treatment. Here's a short script to open your visit. Hi, I'm X. My main concern is X. It started Y hours/days ago. Current status is Z out of 10. I tried A and B. My temperature is XX degrees and oxygen was YY%. Say that within the first minute. It focuses the visit and gets you faster answers. Now, let's talk camera exams. What's safe and useful? Low-risk things you can do. Hold a close-up photo to the camera for rashes. Use a flashlight app to light the throat or ear. Show a swollen ankle beside the opposite one for comparison. or sit upright and count breaths while the clinician watches. For rashes, take a close-up in daylight and then a wider shot to show location. For swelling, show both sides. For breathing concerns, remove heavy blankets, sit up, and count breaths for 30 seconds. If oxygen saturation is under about 92% in an adult, that's a strong red flag for in-person care. Is it rude to ask for an in-person visit if I'm still worried after the video? Not rude at all. Use a clear phrase. I'm still worried because my breathing feels worse. Can we make a plan for an in-person evaluation if this doesn't improve in X hours? Give a time frame, 2 hours, overnight, so you leave with a safety net, not uncertainty. Clinicians sometimes switch to in-person when they need a hands-on exam, imaging, or rapid intervention. You can ask, what specific sign would make you want to see me in person? That turns vague advice into actionable thresholds. A few safety rules to keep in mind. Never delay emergency care because you're waiting for a virtual appointment. If the video can't give a clear assessment, ask for in-person evaluation. If your clinician advises you to go in, go. If tech fails mid-visit, switch to phone or ask to send secure photos. The goal is accurate assessment, not perfect video. And never attempt invasive self-exams. Don't press into wounds or force a joint. Leave those to hands-on care. Before we wrap up, 3 quick takeaways you can use right now. 1. Prepare a 1-minute summary. Cause, start time, severity with numbers, and what helped. 2. Take clear photos in daylight. Have meds and vitals ready, and pick a bright, quiet spot. 3. Ask for explicit escalation steps. Get a time frame or specific signs that mean you should seek in-person care. My main concern is X. It started Y hours or days ago and is Z out of 10. I tried A and B. My temperature is XX degrees and my oxygen was YY%. And for escalation, if I don't improve by X hours or if X symptom appears, should I come in or call 911? Use those lines. They cut through the noise. If you want the checklist and the scripts we talked about, you can find the episode checklist linked where you get this show. And if you've had a telehealth challenge you want me to unpack, send it in. I read listener notes and use real examples in future episodes. Thank you for listening. If this episode helped you feel more prepared for a virtual visit, that's exactly why I do this work. I'm Jess, a family nurse practitioner and legal nurse consultant. You can learn more or schedule a consultation at facbynursejessconsulting.com. If you found this episode useful, please subscribe to FAQ by Nurse Jessi, share it, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.